how a separated placenta can sometimes lead to a brain injury in your child. Want to know what I'm talking about here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I am a childbirth injury and medical malpractice attorney practicing law in the state of Maryland, and I would like to quickly talk with you today about some really important information. And that information deals with a situation in which the placenta can separate or detach from the uterus, causing problems, not only for mother in some instances, but for the baby also. And the main focus today is going to be on how this can lead to, in some instances, a brain injury in your child. All right, okay, so let me back up here and give you some foundation as to some very important terms that you need to understand before I answer that question. So when you have a situation in which the placenta separates or detaches itself, that is called placental abruption. Yep, that's the word for it, placental abruption. And you can sometimes have a partial separation or detachment, or you can have a complete separation or detachment. And this is problematic for mother in the sense that it can cause severe hemorrhaging or severe bleeding. And when this occurs, of course, you've got to be on the lookout for things such as shock or even in certain instances death, because mother can lose too much blood. Now, when we're looking at blood loss on the mom's part, remember the baby is a part of mom. So if we've got a situation in which there is massive blood loss or if there's significant blood loss, the baby is going to feel that too. And how does it show itself with the child? Well, what you can have is you can have a decreased level of blood and oxygen getting to the child because of what is going on with mom. And if the child has a decreased level of blood and oxygen, now you're looking at possibly a fetal hypoxic situation or hypoxic ischemic encephalopathy. Anytime that we have that reduced level of blood and oxygen, there's always a chance that the baby can suffer we call a brain injury. Now, I used that term earlier, hypoxic ischemic encephalopathy, and what that is essentially dealing with is a reduced level of blood and oxygen getting to the baby, which can lead to a brain injury. So when doctors have, or when they are alerted to a possible placental abruption situation, they have to take the time to really pay attention to what's going on. Because like I said, even if you have initially a partial separation or a partial detachment, due to the contractions and just the stress of labor, that partial can turn into a complete detachment in a matter of time. So when doctors are looking at this and they're paying attention to mom and they're paying attention to baby and they are looking at that fetal heart monitor and the strips, when they're looking at all of this, if these things, or if this strip, for example, is showing that it's not reassuring anymore, that the child is no longer tolerating that vaginal delivery, and you've got a placental abruption situation going on, doctors have to move to help mom and baby. And generally what you'll see is an emergency C-section is performed to try to help out in a situation like this. So why have I taken the time today to talk with you about some really important information here? Because if you are watching this video, maybe your child has suffered a brain injury and you know that there was some situations with your placenta. Maybe you did have a placental abruption going on during your labor and delivery, and now you just don't know what's going on in the future. You don't know how your child is going to meet certain challenges. Maybe you're watching this because your child now has a subsequent cerebral palsy diagnosis and you're remembering back to your labor and delivery and you know that there were issues that were present. Well, if you have all of this going on and you would like to speak with me further about what's happening, this is what I invite you to do. Go ahead and pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland childbirth, injury, and medical malpractice questions just like yours all the time, and I'll be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I am one of the childbirth injury and medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Take care and enjoy the rest of your day.